can you just verify your name and date of birth for me, please? Curtis Jameson, 1212XX. Nice to meet you, Curtis. I'm your nurse, Samantha. This is my assistant.
I'm Frank.
Hello, Frank. Okay. Frank. And so today, I just want to see if you have any like pressure injuries, ulcers, or any redness since you've been admitted into the hospital, okay? Mm-hmm. All right, so if you can please, I'm going to lower the head of the bed. Okay, and then now I'm just going to raise the level of the bed to my height. All right, if you could do me a favor, can you turn to your right towards my assistant, please? All right, now I'm just going to check your bottom for any redness. All right, so you do have some slight redness on your coccyx, so what I'm going to have to do is turn you every 2 hours, and I'm going to put some pillows underneath you to relieve some of that pressure. Okay, I have some pillows.
Okay, so as you can see, the patient has both a chuck and a draw sheet. So we want to place the pillow underneath the draw sheet. If we place it directly on the chuck, if the patient does have a incontinence episode, then we're going to have to do a complete bed change, and we want to prevent that. So that's why we put it underneath the draw sheet. So as you can see, she put it under there. She's going to go ahead and take the draw sheet and the chuck back. Okay, go ahead and lay back on your side. Next, we're going to go ahead and place a pillow underneath your knees here. How does that feel?
That feels good.
All right, so we're going to cover her back up, and then we're going to lower the bed. Give her call light, and then ask her if she needs anything else before we leave the room.
No, I don't need anything.
It was a pleasure.
Thank you. Thank you.
Okay, so now we have the pillows lined up. So depending on our role, if we're a CNA or we're a nursing student, we'll let the nurse know or our partner, the CNA, know what we did. We're also going to document it. Next, we're going to explain to the patient that we're going to do this every 2 hours. So right now the patient is lying on the right side. So there's a whiteboard usually in the room. We're going to go ahead and write right. And then the time that we did it at. So right now it is 2 o'clock, so we're going to write right 2 o'clock. Then we're going to educate the patient that in 2 hours, which would be 4 o'clock, we're going to come back, and then we're going to rotate the patient to their left side, replacing the pillows on the other side, and then we'd again write the time down, and then we'll come back another 2 hours after that and place the patients flat on their back. That way the patient has 2 hours of offloading on the coccyx, back and forth. So we'll do that 24/7 around the clock to prevent a pressure ulcer on this wonderful patient.